Bismillah ar-Rahman ar-Rahim. In the name of Allah, the most merciful. I want to start the program with the saying of the Holy Prophet, may God bless him and peace be upon him and grant me the peace. Ma anzalallahu da'a illa anzalallahu al-shifa'. Allah Almighty has not sent down any disease that cannot be cured. Viewers, I'm Sami Malik from Truth UK. As you all know that on my strong request of human service, we have till now through Dr. Anthony Leeds, a renowned diabetes expert and the professor to prevent and treat dangerous human disease. 3 series of cures have been brought to you, and thank God it has not only been incredibly well received, but millions of people from all over the world have been requesting to continue this series. Especially Dr. Anthony Leeds for helping us in this humanitarian service of request, which he kindly accepted. I once again thank you, Professor Dr. Anthony Leeds, from all over the technical team, and especially the CEO of Eawaz, Arfam Zafar. Professor Dr. Anthony Leeds, welcome.
Thank
you. I'm grateful to you for your accepting our invitation for a great humanitarian service in your very busy schedule. I will ask a few questions to you, Dr. Anthony. The first question, why are you presenting a new series of Health Chat episode?
Thank you, and thank you very much for talking to us this afternoon. I think the most important thing about the idea of having a new series is that, first of all, there's a very great need for this. An important part of public health education is to provide the material which is needed. And of course, you can provide it once and a proportion of people will watch it and maybe act on it. But I think you have to keep on providing new information in different ways. And our reason for moving to a 4th series of talks is because of the need for educational material for public health purposes. And the second reason is, of course, that we had been focusing during the course of the last talks, and indeed many of the previous ones, on diabetes and the problems that it creates and the conditions that are linked to it. And also we were referring to new evidence that reducing weight in those who have type 2 diabetes would actually help them in some cases to move back to a position of not actually having diabetes. You remember that in some of the discussions we considered the fact that most doctors and indeed patients regard diabetes as a disease which is just progressive. Once you have the diagnosis, you just proceed through a series of treatments, diet, oral drugs, medications, and then ultimately insulin, and that there's no other option. And what has been shown now in some very large studies in the United Kingdom, and indeed in other countries as well, in the Middle East, in Australia, New Zealand, and 1 or 2 other places, that actually if people lose enough weight, they are actually able to put their diabetes into remission. That has been shown very clearly. One of the interesting things that will come up in the next series is discussion about the evidence we've got for keeping that remission state for longer. There's some new material that will just be published very shortly, and we'll be looking at that. So we were addressing a very serious issue. Now, why is that a serious issue? It's because if you look at the statistics, and I've put up now for you one of the images which I'd used in a previous talk, which looked at some of the figures for Pakistan and nearby countries in terms of the proportion of the population who have diabetes. And you'll see that in the surveys that were reported in 2021, a very large proportion of the population, adult population in Pakistan, actually had diabetes. And the projections in terms of taking account of population size change, and also the fact that the general conditions will mean that a greater proportion of people will have diabetes, mean that the numbers of people who will develop the condition, which means they will then go on to have all the complications and so on, and who will be in need of treatment and help, will be enormous and will put a great strain on healthcare services. So the reason I think why we're moving forward with a new series is the need from an educational point of view, and the second one is that we were dealing and will be dealing again with a really serious public health issue.
Why was the 3rd series so popular? I mean, I realized that you also realized actually the first within the first 2 or 3 days actually the people, I mean, more than 2 million people actually view this program actually.
Well, you very kindly and your team very kindly provided information, and of course they had done an extraordinarily good job in informing lots of people about this, so that people were aware of it. And I think that's one of the interesting things about producing material like this, is if you produce it, if nobody watches it, it's not going to be very effective. But your team ensured that a very large number of people were aware of it. And in fact, we know from the analysis that just under 4 million people actually clicked on the page, just under 3 million stayed watching the programs for up to about 15 minutes, and then 2 million actually continued right to the end, which was usually at around 23 minutes. Now, this is actually a very unusual pattern of viewership, because my understanding from talking to people and what I've read is that people actually don't usually watch very much of anything. So it's an extraordinary achievement, and I hope is a reflection of the fact that we have a very loyal viewer audience. So thank you to all those of you listening now, and I hope that you will find the forthcoming series very interesting. That's, I think, part of the reason. And also, I think also the topics. And we have to bear in mind that,
of course, yeah,
with countries having such a high proportion of people who actually have diabetes, it means that
that's
everybody
right.
has somebody in the family who is affected. So everybody has personal or second-hand experience of helping people who have diabetes, and they're aware of the problems. They know it's a serious issue. They know it's treatable. They know that treatment is expensive sometimes, and that we really globally have not yet got to grips with the problem of increasing prevalence. We all know what needs to be done, but actually it's not being done effectively.
What were the main message that came out of the series 3 episode, actually?
Well, there were 10 programs altogether, and we covered a number of topics, didn't we? We looked at this whole issue of diabetes remission, and there was a detailed description from Professor Mike Lean of the trials that have been done in England and Scotland, in which we used a formula diet program to achieve the initial weight loss of around about 12 to 15 kilograms, and to get remission in about half of the people who actually achieved that. So that was a sort of brief summary of what was known there. But then we also, of course, heard about the trials that were done in the Middle East. So we know that this is a type of intervention which is acceptable to people in the Middle East and North Africa. And then, as I mentioned in one of my comments, we also know that from another trial that was undertaken that included studies in Australia and New Zealand, that indigenous peoples, Pacific Islanders and Maori people, and the indigenous people of Australia can also manage to do this type of weight loss program. So the first thing, I suppose, is the most important message is that weight loss of around about 10% to 15% of the body weight is achievable. Many physicians and many dietitians believe that it's difficult to do that. Yes, it's difficult to do it with conventional diet, but with this special diet it is possible. It is possible with conventional diet in a small proportion of people, but we need to get a large proportion of people actually doing it. So we know it's possible. The second message that came out was that this doesn't just apply to diabetes, because a lot of conditions are related to body weight. So I mentioned also sleep disturbances, which can also be improved by losing weight. And we also know, of course, that cardiovascular risk factors like high blood pressure and blood lipids are improved. Blood pressure comes down by losing weight. This is very important because high blood pressure is a risk factor for stroke, and also, of course, high blood pressure and lipids, and also insulin sensitivity, which is another thing that's improved by losing weight, are factors in causing cardiovascular disease. And globally, deaths from cardiovascular disease represent a very high proportion of all disease in later life, and also are obviously very treatable. And I suppose the other important thing is that, bearing in mind that globally we have an aging and somewhat heavier population with those in the older age groups, that there are other diseases associated with old age like osteoarthritis. And as you know, I work with colleagues in Copenhagen, and we've shown very effectively that a weight loss of 12 or 15 kilograms in people with osteoarthritis tends to reduce the inflammation, reduces the pain in the joints, makes them more mobile. And the people I've seen in Copenhagen who followed this program have been able to tell me that they can get back on their bicycles and cycle around the town again, and that when they play with their grandchildren, they're actually able to get up off the floor, having sat down on the floor to play with them. Whereas previously, those who have osteoarthritis quite often have great difficulty in making some of these movements. So a huge possibility for helping people with a variety of conditions that are caused by or associated with obesity is possible. Obviously, there are some other approaches to losing weight. You can use medications. And one of the things I aim to do in the next series is to talk about the use of drugs in the management of obesity. And also, of course, there's surgery. And I spoke to two of my surgical colleagues in the previous series, and I will quite possibly be talking about surgery again. So we're going to try and draw together some of the threads of dietary treatment, drug treatment, surgical treatment in helping people who are too heavy to lose weight. And as usual, and it's very important to note that for each program I provide a bit of text underneath it which summarizes some of the key points, and I'm also providing some web links to sources in the different countries. And I should add there that having done the analysis of where people are watching, we now know that we will perhaps have to extend the range of the web links to cover some other countries in addition to the ones that we're currently covering. So getting all that feedback was actually very useful. But I think the most important thing to say is to say thank you to our very loyal audience who are watching and listening for a long time, and hopefully gaining some useful information as a consequence.
Thank you very much for your very detailed answer for that. But let I ask the one question that's coming in my mind for the sake of interest of the viewers. What will be included in the new series actually?
Well, we will be looking at some other areas, and again, as you know, my background is in nutrition in relation to disease, and so we're going to cover some other areas where nutrition is important as a part of the way in which you can help people. So in relation to eye disease, and I'll be talking to one or two people in relation to different eye diseases, and then also heart disease, cardiovascular disease, where of course diet is a very important component. Drugs are very potent and are very effective, but there is still a place for controlling weight and also changing the composition of the diet. So I'm expecting to be able to talk about blood lipids as well. So cardiovascular disease, eye disease, and then of course we will revisit the most important topic that we have been considering, which is diabetes, because there will be some new evidence to discuss.
Professor, as you know, actually, the South Asia, especially the third world, actually, so a lot of disease actually related with the diabetes, actually, So, do you have any final comments? Actually, I'll give the advice. To South Asian peoples actually, which have a very big number of diabetes actually, because a lot of disease actually does come from the diabetes actually.
Yeah, well, of course, diabetes, if it's untreated, can go on to affect the eyes and the kidneys and also nerves, and of course cardiovascular disease, which can become very serious. And so it's very important to actually catch the condition very early on. And of course we focused on weight loss and the fact that obviously in the Western world, in Australia, New Zealand, of course, the prevalent, and in North America and indeed in South America, the prevalence of obesity is rising dramatically. So we tend to associate weight loss as being an important part of helping people with diabetes. But what about the people who are not actually overweight or obese? And one of my colleagues, Professor Roy Taylor, up in Newcastle in England, has actually undertaken a study on those who do have type 2 diabetes, but who are not technically what we would call obese. They're perhaps a little heavier than they ought to be, but it's not great, and they wouldn't normally be identified as being people who need to lose weight. Now, what he's done with those is to pass them through the same program where they lose 10 kilograms, 12 kilograms, and he has shown that it is possible to help those people to move into remission as well. And what it relates to, in fact, is the fact that just looking at the whole body in terms of whether or not there's too much fat, it's important to bear in mind where the fat is actually located and what it's doing. And of course, we're concerned about fat in the liver, fat in the pancreas, and you can be not particularly heavy and yet have too much fat in the liver and pancreas. And losing weight actually reduces that and changes the whole dynamics of the metabolism in a beneficial way. And shortly after the diagnosis of diabetes, it's possible to put individuals into remission. Some people, not absolutely everybody, but many people. And so this is something that should be available. So now turning to the South Asian population, of course, the prevalence of obesity is not as great, but the association between the amount of fat in the liver and the pancreas is such that losing weight in people in South Asia is a good thing to do. Now, we do know from a trial run by Professor Mike Lean and Professor Naveed Sattar up in Glasgow, on people living around Glasgow in Scotland who are originally from Pakistan, that they are able to achieve weight loss and remission in the same way. So that has been done. And so the very next thing that needs to be done, of course, is to do a demonstration of the efficacy of this actually in Pakistan.
Viewers, with this, we ask for your permission. We request you to inform inform this program about all the friends as much as you can. And if you benefit this program, then inform your friends. If not, then please, you may ask the question. You can write to us, and definitely we will ask this question to Professor Akshar for his kind attention. And thank you very much, Professor Anthony Leeds. I'm very grateful to you once again for giving us time for this good work, despite your busy schedule. Thank you very much.
Okay, thank you. Thank you.